I'm Kelly Correas. I'm Program Director and I teach in the Respiratory Therapy program. The demand for respiratory therapists is growing as respiratory therapists take on more of a role in case management, disease prevention, and early diagnosis of pulmonary disease. And the demand is expected to continue to rise. Respiratory therapists who work in the hospital work in the intensive care unit as well as acute care. They also work in the emergency room and operating room.
That was one of the reasons that drew me into becoming a respiratory therapist, is that we have a lot of options. Once you branch out into different areas, and you can decide there if you want to become a lead, supervisor. It just really depends on how far you want to go as an individual.
We don't typically have the same kind of work as a nurse has because we carry more patients, so I can range anywhere from 5 patients to 30 patients. And I go from 1 floor to 5 different floors. Basically birth to geriatrics to death.
Community colleges have a long track record of producing quality graduates. The cost is unbeatable, and employers in our field are looking for community college graduates.
The classes are geared towards learning the skill at hand, so we have lecture and then we have lab right after. So what you learned in lecture, you get to apply hands-on in lab.
And it's really nice to graduate and apply everything I was taught and have a doctor acknowledge you right off the bat.
To be a good respiratory therapist, you have to have good communication. You have to be very direct with your patients. You have to be compassionate.
So you have to be able to think critically, really assess things quickly.
Students who are interested in respiratory therapy need to be aware that respiratory therapists do work long hours on their feet. They typically work 12-hour shifts, and that includes night shift, weekends, as well as holidays.
I absolutely would recommend this path to people. I've been in it for a year already, and it's changed my life.